You're watching Federal Workforce Fallout, where each week we break down the impacts to our neighbors in the federal workforce. I'm Larry Miller. This show is dedicated to the reduction of the federal workforce and the impact that it's having on workers, their families, and our local and national economy. We're providing context, fact-checking claims, and giving you advice from career experts. Over the next 30 minutes, we're going to give you the most comprehensive outlook we can of the Trump administration's ongoing efforts to shrink the size of the federal workforce. Well, we kick things off with a new report from the U.S. Government Accountability Office that's raising a lot of eyebrows this week. Well, no doubt you remember that before the 2024 election, Elon Musk promising to cut $2 trillion in federal spending when he was tapped to lead the Department of Government Efficiency. Now, we've reported in the past that they didn't get anywhere close to that number. And now we're learning that the numbers that were reported weren't even accurate. A GAO report found that DOGE posted incorrect estimates of savings or provided no evidence to support claims on its Wall of Receipts website. Of the $110 billion worth of savings listed, the report was unable to verify nearly 96% of canceled grants. The GAO said that more transparency is needed to determine actual savings from contract, grant, and lease terminations. Well, many local politicians who have been major advocates for federal workers have started speaking out after the release of this report. Maryland Senator Chris Van Hollen posting this on social media saying, quote, that Elon Musk and his DOGE boys wouldn't shut up about the billions in waste that they were finding. Turns out most of that was a lie. Shocker. This was never about waste. It was about undermining Americans' faith in government and grabbing big government contracts for Trump's billionaire buddies. Virginia Representative James Walkinshaw also speaking out, saying that this week's bombshell GAO report shows that DOGE fraudulently lied to the American people. Elon Musk promised massive savings. Instead, DOGE spent nearly $16 billion paying people not to work and fired essential federal workers the administration is now trying to hire back. He's now calling on Congress to subpoena Elon Musk to answer for this report. Well, we are also following a group of transgender federal workers who are suing the Trump administration over a policy that removed gender-affirming care from federal employee health plans. The lawsuit argues that the policy discriminates against transgender workers. Kathy Harris, an attorney representing those workers, spoke to me about the case. Kathy, thank you so much for your time today. We really do appreciate it. We understand that there's been yet now another lawsuit filed against the Trump administration and specifically against OPM as it relates to gender-affirming care for trans employees in the federal workforce. Can you give us a little bit of background about the lawsuit, why it's necessary, and what you hope to achieve?
Sure. At the beginning of the second Trump administration, OPM issued a carrier letter, basically instructions to all federal employee health benefits plans to stop covering gender-affirming care for transgender enrollees in the health benefits plans. So that applies to federal employees, their dependents, and retirees and their dependents. This is a change from the last administration in which these services were covered. So this is discrimination, plain and simple, against transgender people, and it violates the law. It's discrimination on the basis of sex, and Human Rights Campaign and a bunch of really courageous plaintiffs stood up and are fighting.
The Trump administration, in talking with OPM, has said that that these sorts of care, the sort of care that has been provided in the past, isn't sort of in line with the administration's positioning on these sorts of issues. That this should be something that is also sort of cost prohibitive as well when you think about sort of healthcare costs. What's your response to some of those critiques from the administration regarding why they felt that this change was necessary?
Well, I think that medically necessary care is medically necessary care. And the amount of people in this program who would need this care is really a drop in the bucket compared to the 8 million folks who are relying on federal employee health insurance. Mm-hmm. So I think the financial impact is a red herring. But in terms of discrimination, I think people need to think about, what if this were you? What if the administration said, we're no longer going to cover care for those over the age of 65 because we think it's too expensive? What if they said we're not covering care for uh, insulin because we don't believe in that for those who have diabetes? So I think when the administration targets people for certain healthcare coverage simply because who they are, that's un-American, and we need to stop that.
Is there any concern about what the outcome potentially of this could be? I mean, considering we think about the Supreme Court, we think about sort of this somewhat the rollbacks that we've seen recently. Is there any concern that something like this may find itself in a similar position?
Well, listen, what's the alternative here? Do we just sit back and do nothing
Hmm.
and let families suffer? I don't think that's the right thing to do. I also believe in the rule of law, and the way the law is right now, the law of the land, the Supreme Court has said that in the context of employment discrimination, gender identity is covered. The Supreme Court held that in Bostock. So, how will the Supreme Court rule in this case? If it ever gets there, I have no idea. But what I'm hopeful is that the rule of law stays and that people feel supported, seen, and heard that we're fighting this good fight.
Can you walk us through some of the impacts that this policy change has had on the families, and even some that aren't included in this case, about sort of the financial burden on them, the time burden on them? Can you walk us through that?
Sure, we've heard stories from class members who've been cut off from mandatory post-surgical care despite having had surgery prior to the policy being in effect.
Hmm.
So they had surgery, they need certain care afterward, and that's cut off. And so they're faced with an untenable situation, having to pay unknown amounts of money to care for their bodies and mandatory care that their doctors have required, or risk complications with already completed surgery. There are others who rely on hormone replacement therapy to be who they are and to live whole and productive lives, who are being told now that that's no longer covered. And for certain people, the changes that have been that they've done in the past, they rely on this care. It would be harmful to them to not continue HRT. So that's also really a significant financial impact on families in deciding, do I pay for hormones or do I put food on the table? We've heard people um, say, well, I've got to leave federal government. I've got to go work somewhere else so that I can get this care covered, which I think is what the Trump administration wants. They want to drive transgender people and those with transgender people and their families out of federal government. And I think that's wrong. We put in a lot of time and money into training civil servants, and we don't want to lose good people just because of discrimination.
Hmm. Kathy, there's going to be a lot of people watching this. For those um, that are watching, what do you want them to take away from our discussion? What should they know?
So I first want to give a shout out to transgender federal employees and their family members who may be scared, frightened, and really concerned about everything that's happened. And I want them to know we're fighting for you and we're here for you. And if you want more information about the case, you should go to the website, www.hrc.org, FEHB class action. Sorry,
No, it's a lot.
FEHB class action. Google
Okay.
it, you'll find
Yeah.
it. And there's a lot of information about the case. You can stay up to date on what's going on. And for those who don't understand what we're doing and want to learn more, I would encourage you to think about how this would impact your own family if really important healthcare was cut off from you and your loved ones. I think we've all experienced the frustration of healthcare in America
Mhm.
and understand that reforms need to be made. But if this can happen to a group of people just because of who they are, it could happen to you and your family members next. And I say courage is contagious. The plaintiffs who have stood up in this case are extremely courageous and brave to be fighting this fight. And if enough people stand up and say that these things are wrong, these kinds of practices will be stopped. So I would encourage folks to reach out to their representatives, their congressional representatives, to speak out to their neighbors and family members and say that this is wrong and we need it to stop.
All right, Kathy Harris, we will leave it there. Thank you so much for your time today, fam. I really appreciate you.
Thank you so much, Larry, for covering this important issue.
Absolutely.
Still ahead on federal workforce fallout, federal workers are losing faith in public service, and a new survey reveals why. The concerns it could have a lasting impact on the federal workforce. Welcome back. A new survey is raising concerns about the future of the federal workforce. Nearly 2/3 of current and retired federal workers say they wouldn't choose public service again, citing job security and benefits. John Hatton with the National Active and Retired Federal Employees Association says the culture of federal service is changing. We spoke with him about what that could mean for the government workforce.
All right, John, thanks so much for being here with us. We know that the last 2 years have been quite difficult for federal workers. There's been a lot of changes in the space in terms of the way that the workforce has been structured, the layoffs that we've also seen as well, and just the continued sort of attack, some would call it, from the administration in terms of how they view federal workers and ultimately how they're being treated. And some new data that you're providing from us from a recent survey is also shedding some light, too, about sort of the health of the federal workforce.
Yeah, we surveyed our members and we asked them, knowing what you know today, would you choose a career in federal service again? And we asked them to rate that on a scale of 1 to 10. And 64% rated that 1 to 4, meaning they're unlikely to recommend a career in federal service again. And that's compared to just 26% that said they would be likely to do so. And I think that's a real sea change in what we would have seen in the past. It's a real difference from what we've seen in terms of engagement scores on the Federal Employee Viewpoint Survey. And I think it's going to be a real detriment to the functioning of the federal workforce.
What does that mean for the American people?
I think that means it's going to be harder to get the skilled, qualified employees into positions that we need to take care of what we're asking them to do on behalf of the American people. Whether that's a scientist assessing medical research and assessing or assessing drug approvals, if that is somebody working at NASA. There's a lot of somebody assessing the next weapon system and contracts over, and procurement for what we need for our military. Doctors and VA nurses. All these people have a lot of skill and experience. They require education. They require a lot of training. And if you have an environment within the federal workforce that doesn't value professionalism, it values politics over professionalism, that, in a federal workforce that typically is paid less than the private sector, if the culture starts to be lacking respect for the job they do, the mission they do, and if the job security that they once enjoyed goes away, there's going to be less appeal to get into the federal service, and that's going to be a detriment to the American people.
What are you telling federal workers right now to help them sort of be a bit more optimistic? Is there anything that you can say at this point?
Well, I think the survey responses still showed, a real commitment to mission. And so some of the people who commented and, said that they would rate it low, they said, in 2024, I would have given it a 10. And I've proudly served the American people for more than 20 years, but then it's been this recent sea change. So I think, if we can get a little bit back to normalcy, there is still a lot of pull to that mission. And we're certainly working to try to preserve that kind of nonpartisan professionalism within the merit-based civil service. I think there needs to be a continued push for that. And I think underlying, when people work for the federal government, their customer, the people they're serving are the American people. And so there has always been a real call to service and to mission. And I think the challenge will be preserving that and hoping that this is a temporary blip on the radar that we can kind of start to reverse a little bit and not one that's permanent.
Does there appear to be bipartisan support in trying to find compromises here? I mean, things have been quite contentious on Capitol Hill as of late.
Yeah, with regard to maintaining the merit-based civil service, there's a little bit of support from some Republicans in the House, but it's mostly not bipartisan, and it's been a challenge to get that type of support from both sides of the aisle. We've there has been, I think, some checks on the administration through the appropriations process, kind of shoring up and putting some limits on what they're doing. And I think if you look to the resolution of the shutdown last fall, you saw Senator Kaine negotiating a temporary block on these large-scale reductions in force. So the hope is kind of through the appropriations process and through some of these provisions, there's a little bit of check on these further actions in terms of gutting the workforce. And we've even seen kind of reality smack the administration in its face where they're coming to Congress and asking for full-time employee counts that are back higher to restore after they've made all these cuts. So I think the reality of what they need to produce and do is going to force kind of a limit, hopefully some limit on their actions. And I think the exception is in areas where their intention may be to simply gut the agency or the function because it's not something they prioritize. And so we'll see a mix of that, but I think there's still that potential pushback from Congress.
Well, John, walk me through the rest of the year. What does that look like for the union? What do you think that looks like for the workforce? Anything of concern that could be on the horizon that people should know about?
Well, we're coming up to another funding deadlines and another potential shutdown. I think the good news is it looks like the Senate is going to pass a continuing resolution extending funding into December. The hope would be that the House passes that same bipartisan agreement and gets us at least past the election. There's been some discussion of legislation that would prevent all future government shutdowns. I'm not sure that's going to be taken up, but it has, I think, closing in on enough support from a bipartisan group to get somewhere. We're continuing to deal with some of these new administrative policies coming into effect, whether that is people being reclassified into scheduled policy career, the ability of OPM to fire people for suitability and fitness reasons or because they didn't sign a non-disclosure agreement. So there's still going to be a lot of challenges, I think, moving forward from administrative policies. And my hope is we at least have some stability with the appropriations process and funding. We don't have another long shutdown, though.
All right, John Henton, we will leave it right there. Thank you so much for your time, sir. We certainly appreciate it as always.
Thank you. Thank you for having me.
After the break, a former federal worker lost his job but went on to build a new business. Then he says hackers took that away too. His warning for others. That's next. After a Voice of America journalist lost his job during mass layoffs, he started a limousine business using Uber Fleet. But he says that his account was hacked and then permanently suspended, leaving his business at a standstill. And now he's warning others about how easy it is to lose access to an account and how difficult it can be to get it back. Sarah Robinson has his story.
From tragedy to triumph, back to tragedy. This business owner says that once his account was suspended, he's heard from dozens of other drivers who have faced a similar or the same situation. And now he's hoping that Uber changes their policies so that others don't miss out on their livelihoods like he did.
I don't know where to go for my losses, where to go for my wages.
Alexandria resident Bakhtawar Shah spent 17 years as a journalist at Voice of America
Washington, D.C.
until March of 2025.
When this new administration came in, so they just shuttered Voice of America.
So he started something new. He launched a business called VIP Limo using Uber Fleet, a system that allows business owners to manage multiple drivers and vehicles through Uber. In less than a year, Shah says he grew the business to 3 cars and 6 employees.
My account was hacked on June 28, and then it got suspended.
He says an unknown hacker gained access to his account, triggering it to be flagged as suspicious.
I was in real trouble.
He says he spent days trying to reach customer support, providing documentation he says proved his account had been compromised. But he says he got nowhere.
But they did not accept my appeal, and they completely deactivated my account.
Shah says his account remained banned until WUSA 9 got involved. But he says the damage had already been done. How much would you say you lost in wages for that month?
From $10,000 to $15,000.
Shah says it was extremely difficult to reach someone who could review the details of his case, including documents he provided, like a police report. He believes it should be harder for hackers to gain access to accounts and says Uber needs a quick and robust appeals process. Uber sent WUSA 9 a statement saying, in part, quote, "What happened to this driver is frustrating and appears to be the work of a third-party bad actor." Uber also says it uses two-factor authentication for drivers automatically, and it encourages drivers to never share their passwords or personal information, including PIN numbers. We also asked Uber if they can recover the missing wages or the lost wages, and we're waiting to hear back. Reporting in D.C., I'm Sarah Robinson, WUSA 9.
One last thing before we go, Federal Workforce Fallout Chat with the Recruiters is back. Attendees to the Zoom webinar will get a chance to hear from area recruiters about ways to stand out, strengthen their resume, convey their professional story, and grab the attention of hiring managers. It's a free webinar happening on Zoom Wednesday, August 12th at 1 p.m. You can scan the QR code on your screen for a link to the registration page. You can also find that registration page on our website at WUSA9.com. You can count on WUSA9, of course, to stay on top of the reductions to the federal workforce, those affected, and what it means for our communities. In the meantime, scan the QR code on your screen. It will take you to a special section of WUSA9.com dedicated to our coverage of this story. And of course, we'll keep you updated right here on Federal Workforce Fallout. We appreciate you being here. Take care, and we'll see you again soon.